Our team, the Opioid Prevention Partners, chose to do Cohort 2, Challenge 2, in regards to dentists' impact on the opioid crisis. In the US, roughly 54 million people over the age of 12 have used prescription drugs for non-medical reasons. Of that, roughly 3.3 million are using painkillers, 1.7 million are using stimulants, 2 million are using tranquilizers, and 500,000 are using sedatives. This is a social crisis impacting individuals from every aspect of life. Opioid overdose deaths have increased over fourfold in the last 10 years. Prescription drug abuse-related emergency department visits and treatment admissions have risen significantly in recent years as well. In 2014, the range of non-medical opioid abuse among youth aged 12 to 17 was 6.2%. For young adults aged 18 to 25, it was 11.8%. In less than a year, the percentage of youths abusing narcotics increased from 2.2% to 2.6%. On an average day, roughly 5,800 adolescents use prescription pain relievers for a non-medical purpose for the first time ever. Potential for addiction for these medications is extremely high, as research indicates that overdose and death due to misuse has increased in the last decade. We must seek solutions in assisting in ending this epidemic. Many times, people who have been on opioids long-term consume alcohol with their opioids, amplifying the effects and causing accidental overdose. Another accidental overdose that is quite common is in the elderly, mistaking an opioid for another pill or forgetting that they already took their medication and then accidentally taking it twice. In 1998, dentists accounted for 15.5% of overall opioid prescriptions. However, by 2012, they had lowered it to 6.4%. However, 6.4% is still a significant percentage in overall opioid prescriptions due to dentists being a large minority of the medical professionals. This is a map of the amount of opioids prescribed per person in 2015. In 2015, enough opioids were prescribed to keep every person in America medicated 24/7 for 3 weeks of the entire year. In 2016, for every 100 people in the US, healthcare providers wrote 66.5 opioid prescriptions. Of these opioid prescriptions, many oral conditions occurred, many which were extremely detrimental to people's oral conditions. The dental management of opioid dependence is often complex. As such, the dental professional needs to be aware of the wider issues associated with these patients in order to manage them successfully. It's extremely important to develop a high awareness of the implications of oral health care in societies where such dependency is so widespread. What we did is we looked into things that haven't necessarily worked, which is statewide opioid tracking, pain management, recommendations for rehab, refusal to prescribe narcotics, and DEA recommendations. Our solution is a machine that tracks all dispenses per individual that no pharmacist can override without patient having received medical attention. This machine will be on a national level and not at all insurance related, so anyone will be able to track on a national scale to stop seekers from going state to state for different prescriptions. Hospitals save millions annually with proper prescription control from treating illegal opioid infections. This will be paid by government grant programs supporting the fight for opioid and misuse of prescription abuse. There will be many benefits that associate with this, including it's completely reliable, it tracks all dispenses, it contains accurate and real-time information, it's affordable due to hospital savings on government grants, and it's monitored by top data analysts. The opioid epidemic is a terrible situation that kills thousands of people every year, while millions are still addicted. In order to stop this, we have to find a way to effectively track where all the prescriptions are coming from. Together, we can all do this together.